everyone, I'm Dr. Raquel Butler and I'm looking forward to talking to you today about rehabilitation and the golden path. So we're going to cover a number of things. We're going to talk about the importance of the diagnosis, the different factors that come into designing a rehab plan, and the foundations, as well as how we measure progress and dealing with those setbacks that can come along. So the first thing is, why do we want a rehab plan? Like, why can't we just put them out in the paddock, give them rest and bute, and bring them back in when they've had enough time off? And some of those important factors are that we want to be able to measure the progress. So we want to know where they're up to in their healing and that we do have a complete healing. We also want to know in that progress that we've dealt with any kind of secondary adaptations due to the injuries or compensations, because these are the problems that can continue to persist and affect the biomechanics in adjacent areas and potentially lead to injury down the track. So we want to make sure that we've addressed those and we've got the body back into a good program again in terms of its movement. We also may want to improve the primary cause. So the primary cause could be an underlying postural issue or a hoof balance problem, or even a dental issue. And so we want to make sure that we have improved that primary cause to avoid injuries happening again, especially, if it occurred during performance. And then ultimately we want to improve the outcome. So we want to reduce scar tissue and adhesions. We want to make sure that we've got full range of motion back in that area and leading to, the horse's improved quality of life overall. And hopefully getting them back to full performance, and if not better than they were before. Because, there have been studies to show with limited rehab that they have ended up kind of breaking down in future performances, whereas horses that are being completely rehabilitated with kind of good outcomes have gone on to often perform at higher levels. So what we don't want is a continuum of the injury cycle where we have pain and spasm, reduced circulation, atrophy and weakness of the muscles. We get strain and restrictions in the body, adhesions that cause further restrictions, and then we have a cycle again of injury, maybe in the same area or other areas, and pain. So we really want to try to reduce this. And lead into the recovery cycle. We also want to recognize that in that recovery cycle, rest is generally never a good option. And when I say that, I mean immobilization. So there have been studies to show that immobilization in humans, even not for a problem, has led to reduced bone mass, even after returning to exercise for a number of weeks and months. And the same in horses. They put a cast on horse limbs for 7 weeks. They didn't have a problem. And even after 8 weeks of exercise, they hadn't returned to their pre-function state. So that's without an injury. And so we always want some degree of mobilization, whether that's walking or other, it might be just a passive range of motion of the limb to stimulate the muscles, to stimulate the circulation, reduce inflammation and edema. And so that's really beneficial in that movement. So just, locking them up and not doing anything is not a rehab program, and putting them out to pasture with pain relief or not for 3 months is not a rehab program. So at the end of that, you will still have to bring them back in and do a program to build them back up. So what we want is that the injury occurs, we manage the pain, we have appropriate treatments, which we'll talk about, we maintain circulation, reduce the muscle spasm, reduce atrophy and strain, and minimize the movement restrictions. And we optimize the posture. And this will ultimately lead to recovery and the improved outcomes that I've discussed. And there'll be happy days. So one aspect is the veterinary diagnosis, and having a veterinary diagnosis means that you can have a better prognosis, so you can understand, what tissue has been injured, how long, they generally take to improve, how severe it is, and what you can kind of expect there. So it's going to help you also to monitor progress, because if you have that original diagnosis and perhaps they were, 4 out of 5 lame, they showed abnormalities on ultrasound and x-ray, or other diagnostic tests, then you have that to look back on and go, well, now our ultrasound's a lot better, as well as a lot of other aspects that we'll talk about that you can monitor too. The important thing to recognize with this is that just because you do have a diagnosis of one injury, it doesn't mean that that's the only injury that's occurred. And often we do see that, because that's the area that's causing the most pain, it can easily miss other kind of areas that have been damaged. So we've got to keep this in the back of our minds as the horse is healing, so that we can address that in the rehab program. And we also don't forget the compensatory limbs as well, because often the horse, there have been stories of where horses have healed really well in their primary injury, sometimes from catastrophic fractures, but it's the weight-bearing limbs that have actually broken down, perhaps from laminitis, or I see like sacroiliac restrictions when they've got a lame hind limb. And so we have to consider those as well. So the veterinary diagnosis is really important, but we still have to keep that overall holistic view of the horse, and consider other areas that could have been injured. The injury factors. So we've got our diagnosis, and then we want to consider, okay, so is this an acute or chronic injury? So has it just occurred, or has it been there for a really long time, and now we're kind of dealing with some of those consequences because perhaps they've re-injured themselves, or they didn't get a rehab kind of program at that time, and so we're dealing with that. What tissue has been affected, which we'll have from our diagnosis. How much pain are we dealing with, and how we're going to manage that? So generally, after a few days of bute, probably trying to avoid any more than 5 days. If you've still got to control the pain, we need to be looking at alternative options. So herbal, homeopathics, your treatment modalities, body work, because we don't want that long-term bute effects on the liver, the kidneys, and the gut, especially in getting ulcers, because that's just going to compound their healing. We need a healthy gut for good healing. We also want to know, well, what mobility do they have, and what mobility should that area have? And the stage of the healing. So are we still in the inflammatory stage? Do we still have swelling, hemorrhage, and a lot of pain? Are we in the regenerative stage, where we're looking at building flexibility and strength and managing the scar tissue? Or are we in the remodeling stage, where we're building further on flexibility, strength, and adding in our challenges? So that's really important for your design of the program, and which healing stage they're at, because in the inflammatory stage, for example, you're not going to be doing hard kind of strength type of work. The one thing to recognize with the injury factors is that most horses are really good at hiding pain. They are prey animals. They are designed to hide their pain and protect themselves. And so they're really good at the compensatory mechanisms to avoid that pain. And this can alter, as I talked about before, and set up the compensatory mechanisms in the biomechanics. And so that's where we need that holistic approach. And it can also mask kind of what's really going on. And the other aspect of it is the brain starts to recognize an altered movement pattern as normal. And so this can then become a normal pattern. And even once the injury has healed, that pattern can still be programmed in the neurological system of the horse. And so we have to then consider how we're going to reprogram that motion and make sure that we've really taught the body again how to move correctly. So with the tissue healing, you can see here this graph kind of shows the differences in the different tissues that have been affected and how long they may take to heal. And these tissue times will generally be improved with a really good rehab program and targeted to that tissue. So you can see, obviously, the more severe the damage, such as a grade 3 muscle tear, you're looking at 6 to 12 months. And obviously with bone, you've got kind of 3 to 6 months there, and fascia is 2 to 3 months. So most things are at least 3 months, realistically. It's generally a minimum time, and it's usually 3 to 12 months in a rehab program. So the next aspect is to facilitate a rehabilitation team, and hopefully they all work collaboratively. That's the aim. So your vet's going to be there for your diagnosis, your progress monitoring, and the understanding of the underlying pathophysiology of the problem. Hoof care practitioner. So I generally want to take shoes off horses when they're rehabbing for most injuries, because especially if they're being locked up for a period of time, I want to promote circulation through the limbs and through the body. I also want to be able to adjust balance at much smaller intervals. So generally we'll take it back to 4 weeks so that we can really help the body maintain a better posture. The only time that becomes difficult is when you've got, problems with weight bearing due to the injury, such as, fractured pelvis. It can be quite a challenge then to trim a horse's feet when they're in that much pain. Your body workers are super important, and often the body worker is the person who is, well, in my position anyway, obviously I'm a vet as well, but often the person who's kind of overseeing and supporting the client the most, because I'm there involved in it the most, and kind of being the in-between person. Hopefully in the future we'll have rehab technicians that can help you with the specifics of the exercises and make sure that they're all being done correctly. Saddle fit is going to be important, especially if you've done now a lot of groundwork and in-hand work as part of the rehab program. You may have completely changed the posture and the shape of your horse, and so you may need to get the saddle fitted. But when you've had a period of time out of the saddle anyway, that's going to be important. And some rehab plans involve riding, so you'll want to get it checked in the progress of your rehab plan. And then a nutritionist or a herbalist may be involved as well to aid with the healing. For example, vitamin E is really beneficial for nerve damage, and we might need it for some extra pain relief. You also might need to look after the gut if they're being locked up, and you have to consider nutritionally what they're being fed with their altered calorie requirements, because if they're being locked up, you need to maintain those calorie requirements. You need to feed them at a minimum of 4 to 6 hours, but it's going to be different to their normal workload and normally being out in the paddock. The thing is also to make sure that your body workers and all of these aspects of your rehab team are qualified and insured professionals. That's super important. So I want you to ask these people what's their qualifications, and understand, their passion for CPD as well, especially with the body workers, because understanding the anatomy, the biomechanics, and the exercises will really help the outcome of the rehab program. So the owner is probably a major factor, because it requires your time and commitment. You can build on your skills and the money, well, that really depends. You can still establish a really great rehab program without a whole lot of money, but the time and the commitment and the psychological strain can be challenging. The owner will, generally be the person who determines the outcome of the rehab program, because it's as I said, their time and commitment. Here you can see a superficial digital flexor that's been damaged and it's split. It was a traumatic incident, and by September it was almost completely healed. There's still a little bit to go in there. This horse made a full recovery and got back to riding and jumping, but this owner was so dedicated, and also the fibers look like they're beautifully aligning as well. So that's also the benefit of a rehab program, is that we establish the most normal path of the tissue. So this owner thought about the horse psychologically. She had taping, she had other people involved. She's a vet nurse herself and now a therapist. And yeah, she was super dedicated to this horse, and the outcome speaks for itself. So it is a hard path sometimes to take in terms of rehab, and we do have to consider all of these aspects to determine, well, yeah, can we do it? Do we want to do it? And do all of these factors, how can we make it happen? So the horse is also an important player. The age and the sex, so how old they are, is going to determine their healing capacity, but it will also determine, how much handling and training they've had, and yeah, the prognosis of the injury. The handling and training. So, some horses are mostly ridden and haven't had much in-hand work. And for a lot of rehab programs, the groundwork and the in-hand work is a foundational aspect of that. So there may be difficulties and challenges there with handling. And it also, just could be their age or their sex. It could have a stallion that hasn't done much. Their pain threshold. So some horses do have an amazing pain threshold. As I said, they are prey animals, but then other horses, not so much. And so you have to adapt to that and figure out how much pain relief they need without creating a problem with them running around and doing too much. Their behavior. So some horses can be really bitey on the ground, and they can be really expressive in their behavior. And so we're going to have to be able to deal with that. Their posture. So do we need to improve their overall posture? Was that an inciting problem? Or do we have now postural problems due to offloading certain areas? And we're going to have to kind of deal with that posture. You can't always deal with it as you're going if there's too much pain. So you've got to kind of manage it how you can with your body work and pain relief to try to optimize that posture as it can lead to, as I said, compensatory mechanisms and patterns that the body recognizes as normal. Hoof balance, we've talked about that. Fitness. So having a super fit horse come into a rehab program has its pros and cons. You can avoid as much muscle loss, but if they're super fit and you now have to lock them up, then they can be very difficult to handle with controlled motion. And so you often will have to adapt to the fitness of the horse. Any previous trauma? So is there other previous trauma where they're struggling with the weight-bearing aspect of the injury? I looked at a horse years ago who had done a suspensory branch and it just wasn't healing very well. And as part of the assessment, I don't remember exactly how it came up, but I think I said, oh, his pelvis looks really asymmetrical. She said, oh yeah, he's had a fractured pelvis. Oh, okay, well, it was on the opposite side to the suspensory, and so likely that's why the suspensory has occurred. So rehabbing the suspensory is not going to be the answer. We have to fix his posture and his hoof balance, and that's going to be, an important part of the program. The social situation. So obviously horses are social animals, and if you have to lock them up for a period of time, we want them to stay as calm and relaxed as possible to help with their healing and to avoid other injuries. So you might have to get a friend. You might have to set the yard up in a different area so that they can see horses. You might have to get a goat or a sheep or a pony to keep them company, and obviously one that they like. Otherwise, that could also not be too good. So there's a lot of horse factors that we have to consider as well, and you will know your horse the best. So with your body worker and vet working out the rehab program, you'll be able to tailor it to yourself and the horse factors, and also the environmental factors. So with the horse comes the athletic performance. So is this a horse that's a barrel racer? Are they an eventer? Are they a trail horse? Are they a paddock horse? So what is the level of athletic performance that they've been performing at and that you expect them to go back to, because that's going to kind of change the aims of your rehab program, and, you know, how strong you need to get them and what kind of level you need to get them back to. Also, what facilities are available? So do we have trails? Do we have firm surfaces, hard surfaces, soft surfaces, hills? Do we have poles available? Is there arenas? Is there round yards? Do we have cavesons and long reins? Has the horse long reined before? Is that going to be an option as part of the program? Also, what's the weather like? So, you know, if you're in the middle of spring, it's going to be pretty good. But in the middle of summer, when it's 45 degrees, or in the middle of winter, when it's really dark, then that's going to add challenges onto your program. So you'll have to consider, like, how much time do I have? And what am I going to do if it's a really rainy, crappy day? Is there other things I can do while the horse is standing in the stall? And obviously it can become a problem with slipping in the mud and all of that as well. And the rider is the other aspect in there, which I kind of talked about with the horse owner, but rider skill, rider fitness are also going to be important as you progress through the riding aspect of the program. So then in terms of rehab modalities, it will depend on your vet and your body worker as to what kind of modalities you have available to you, but we want the modalities that are going to be targeted to the injury. So, you know, cold is more in an inflammatory stage, heat is more in a chronic fibrosis stage, therapeutic ultrasound, shockwave, laser therapy can be used for multiple stages, electrotherapies, also magnetic therapies. Kinesiotaping, it can usually be tailored, you tape in different ways for the different stages of healing. Manipulative therapy, so, you know, whether massage is more appropriate, osteopathy, chiropractic, craniosacral, bone therapy, like which therapy, you know, and often now body workers, qualified body workers, have a whole toolbox of different therapies that they can utilize to tailor it to your horse's problem. And then what exercises are you going to do and with the equipment that you have. So the foundations of a rehab program are going to be a combination of balance exercises and proprioception, strength exercises, and then progressing to stamina and endurance later on in the program. But ultimately, for all of these, we need to have as optimal function as we can. So constantly we want to be looking at the function, because if you're struggling with exercises, then often it's a problem of function. And if you don't have function, it's hard to get all the other things. And you don't want to build strength on an imbalanced body. So that function is really important. And that's, again, where your body worker can really help you to maintain that function, as well as certain exercises that you can do, mobilization exercises to help with that function as well. And knowing how that area should function in each of the exercises. And so I mentioned a little bit before about early passive range of motion and walking and the benefits of that in function. And they're going to improve swelling, stimulate production of the joint fluid, remove inflammation from the joint fluid, and improve the cartilage health within the joint. They're going to also stimulate the collagen production and the fiber alignment, depending if it's a muscle damaged or a tendon damaged. So correct function and correct kind of early passive range of motion in most instances is really beneficial. The next aspect is the exercises and their focus. So with those, you want to have a clear aim and goal, both daily and overall. You want to be able to adjust and adapt to the horse. So you want an individualized program for your horse that you can adjust and adapt it to them. You don't want to exercise to fatigue. So initially it might be some trial and error to figure out what fatigue is for your horse, So for some horses, it might be they start to trip and stumble, they start to drag their leg a little bit more, they start to get bitey and a bit irritated, they start to get distracted, they start to kind of fall on the forehand and push through the exercises or knock the poles. And so we want to recognize that, and then in the subsequent sessions, back off so that we maintain that appropriate function all the way to the end of our session. For each exercise, we want to define why we're doing it. We want it to be demonstrable, so we want to know what exactly we're doing. We want to know how we're going to repeat it and how it's done. And we want to know where we're going to progress it to. So defining all those aspects of the why, the what, the how, and the where of the exercises enables you to understand the progression and the aim of those exercises. We also want the horse to be relaxed. A relaxed and calm horse will heal a lot quicker than a stressed and braced horse, and you will get a lot better outcome. So if you're noticing stress in your horse or brace, then you have to try to figure out how you can alleviate that. Like, what is the underlying problem of that? And sometimes it's just confusion, you know, you're learning the exercise, they're learning the exercise, and it can be confusing for the horse. And so they might have brace due to that, or it could be pain, brace, psychological, other reasons for brace. So you want to stay under that brace response and have relaxation. And we want to optimize spinal motion in pretty much every injury. Our progress will be determined by our weakest link, and that could be us as the owner. It could be the body worker hasn't been able to get out there for a while and they need a regain of that function. It could be the weather. It could be the horse itself. It could be the injury and they've re-injured. It could be compensatory mechanisms of the injury. And so you just have to deal with that as it comes up, but recognize that there will be limitations in the progress. And that's the importance of having a really good supportive team around you. So here's a couple of examples of some rehab exercises. This was the horse with the tendon injury later in his rehab process, creating some stretch, and you can still see the tension in his flexor muscles. So we want to create stretch and strength. We're also promoting even weight bearing through those legs. And then this one is the pony that had string halts and doing pickup sticks. And so you can see that's nice and slow and controlled. It gave her time to think about it, and she didn't knock any of the poles, but it was a little challenging for her because you could see her pick up her back legs before she got to the poles. So that would be a consideration in that exercise. So how do we measure progress? So we can measure progress. This is from a paper from Williams and Tabor. We can measure progress through monitoring the horse's pain signs, so facial expressions, other behaviors that may indicate pain, both at rest and during the exercises. We can measure their lameness. So how lame were they at the start and how's that progressing? And that may be with your vet, or you might build up the observational skills. Their muscle symmetry, you can palpate for pain, swelling, edema, fibrosis, and tissue tension, where they're at in the palpation, and also assessing balance and proprioception and their performance and functional capacity. Obviously, that is going to be in the exercises themselves, but also as we progress. You can also, measure joint angles. This is a goniometer, and pressure algometry for pain aspects as well. What you can measure yourself is all of these, but getting a diary and keeping a log of your progress is really valuable, because sometimes you forget how far you've come, and sometimes you forget where they were in those exercises. You might have had a week off, and often we will start too far ahead, but we have to back off a bit. The other thing is taking photographs. So I'd take at least weekly photographs from the back, front, side, and of the injury, because it's really nice to look back and see how far you've progressed, especially when you're having a bad day, and perhaps weekly videos if it's something that monitors that. So yeah, diary and photos and videos are your best friend in monitoring progress along with your vet, and these aspects. So how are you going to deal with the setbacks? So there will be setbacks. We've talked about potential aspects of the setbacks. You're probably going to cry, and that's okay. Have a good cry. Walk away for a day or two, perhaps. Take a day or two off. Obviously, keep feeding the horse. And then talk to your supportive team. Make sure that you are surrounded by friends and family who are supportive of you and not questioning, what you're doing, because that will challenge it. Focus on the present, one step at a time, and remove the expectations, and especially remove any competition expectations on yourself or the horse, and try to remove the time expectations and just breathe and take it one day at a time. So in the plan development, this is a little rehab plan here. So you want to reprogram movement. It takes 6 weeks to establish new reflex patterns. You want to establish that supportive team. You want to have a clear aim, both daily and long term, with a realistic time frame. You want to address the entire body with mobilization as early as comfortable. You want to become a powerful observer of your horse and the injury. You want to monitor your progress with a diary and photos. You want to learn the exercises, the why, the what, the how, and the where. You want to adapt. You're going to have to adapt exercises, confinement, all sorts of things you have to adapt, often, sometimes regularly. And never exercise to fatigue and never give up. However, there are times when you assess all of these factors and you decide that the kindest thing for the horse is to put them to sleep. And I do think that that is a very valid option, especially if it means the other option is putting them out in the paddock to deal with the injury themselves. I think it's much kinder to put them to sleep than to do that. So that's always a valid option. When I say never give up, I mean when you're in the middle of a rehab program and it feels like the shit's at the fan, that's the time, to just not give up then. When you feel like you're not making as much progress, you need to look back at all the progress and talk to that supportive team. So here's a couple of cases that represented patience and persistence. The left one had a lateral digital extensor excision due to string halt, was in casts for a long period of time, months in casts and bandages, and it was a lot of blood, sweat and tears. And the other horse was an upward fixation of the patella. We had to change, what we did with him after a treatment, so he didn't run around too much and then get worse the next day due to feeling better. Both of these horses are now being ridden. This is 5 or 6 years ago. And the owner dedication is what got these horses through. I was there as a support person to help her on her bad days and treat the horses, but it was the owner dedication that determined this outcome. So thank you. Here's some references for you if you're interested, and thank you very much, and I look forward to now chatting with you in the live Q&A.
Thank you so much for your presentation today, Raquel. It was really, really interesting. And we do have some questions that have come through for you. So our first question that we've got is, what would you recommend for pain relief other than bute? Now, this is specifically for a horse with acute laminitis.
Okay, thanks, Claudia. That's a great question. So yeah, it can be challenging in an acute laminitic situation because obviously there is, they are in quite a lot of pain, and it's always the balance of giving bute and walking. I think one of the best pain reliefs for laminitis is actually icing in ice buckets for often a couple of hours, a couple of times, 2, 3, 4 times a day. I think that actually provides the best form of pain relief for a laminitic horse. But other kind of options, so there are herbal options that are available, such as Alleviate from McDowell's. There's homeopathic options like Trawmeal. So they're options that you'd start to implement as you try to reduce your bute. You wouldn't just kind of stop your bute, but I do think icing and then mobilizing as they're comfortable enough, getting them in boots and pads and things like that is really helpful for reducing pain.
So a really holistic approach to that, not just stop bute. There's a lot of things that you've got to do in conjunction.
Yep, absolutely.
Okay, cool. Now the next question we've got is, how would you recommend that this person rehabs a sciatica issue? They want to know if you think ultrasound treatment has its place in rehab, not TNS. And there's a second part of the question is, can kissing spine be diagnosed without an X-ray? Might start with the first bit first.
Okay, so the first part of the question, that's an interesting question. So talking about, what was it, rehab?
The sciatic nerve, sciatica issue.
Yeah, I mean, I would say, well, what's the underlying cause of the sciatica? Is it a lumbosacral problem? Is it a sacroiliac issue? Is it muscle tears along between the hamstrings? I think that you've got to get back to that primary underlying cause and decompress the nerve if that's actually the cause of the pain, and then gradually progress into rehab. I mean, walking is always really beneficial for getting kind of sacroiliac motion, and walking over raised or unevenly raised poles can be really beneficial, but I still think you need to get back to the primary cause of
so this
that,
person
and
really,
where that nerve compression is starting.
Yeah, this person really needs to chat with their veterinarian and their veterinary team to really hone in on what that issue is.
Yeah, and their body worker to try to figure out where's that primary problem coming from.
Cool. So the next half of that question was, can kissing spine be reliably diagnosed without an X-ray?
Yeah, it's an interesting question as well. So with kissing spine, I think people with good palpation skills can palpate along the spinous processes and, assess for pain, assess for the space in between each of the spinous processes. I also think, with kissing spine, it's interesting because I've just been watching a talk by Kevin Hausler and talking about pain and things. And I think, kissing spine is a diagnosis, but you've got to determine what the underlying cause of the kissing spine is, because sometimes the kissing spine is causing pain, sometimes it's just causing dysfunction, and sometimes there's changes within the vertebrae and there may not be, and they might have kissing spine, but it's really not kind of causing the problem. So again, you can diagnose it, but you've still got to look at the horse holistically, and you've got to look at the whole posture, and you've got to decide, is it actually causing the horse pain? And that will kind of determine your rehab program from there. Okay,
so a lot to think about for that person.
Yes.
Now, as someone, Raquel, as you're a vet, I think this next question is quite nice for you. My horse doesn't have any issues at the moment, but is there anything I could train my horse to do that would help a vet in a rehab situation?
Yes, that's a great question. So helping a vet in a rehab situation, I guess implementing groundwork and in-hand work as part of your program, because if you do then ever need to rehab the horse, they kind of have those basic skills. So even, being able to mobilize their shoulders, mobilize their hind end, take their, lift it through their thoracic sling and back up properly, like being able to do those sorts of exercises properly would help you in any rehab plan. So knowing that they're doing, and when I say properly, I mean like they're doing them kind of in a state of relaxation, they're doing them correctly from a biomechanic perspective, they're able to do them in a slow and controlled sort of manner. So that's if you're talking about kind of rehab. If you're talking about helping a vet in general, then I would say conditioning your horse to accept a needle is really beneficial. And there were some great talks on that in the ISIS conference recently, talking about how to utilize positive reinforcement in those situations to make having a needle a non-event for a horse. It's not a stressful problem at all. So I think working with kind of learning theory type things and positive reinforcement to make that not a problem would be so beneficial for your vet.
Yep, and ISIS is the International Society of Equitation Science.
Yeah, thanks, Claudia.
Excellent. I've got that for people. Now, here's one, and I think I find this for my horse as well. My horse seems to warm up and get better as I ride. Is this normal?
So I guess it depends. It depends kind of like it's a really great question. I think warm up is super important for every horse, and your horse should be adequately warmed up before you start to ask for any kind of challenging work. In terms of it, you feel like it's getting better as it warms up, I would ask, well, what do you know about its underlying problems? You know, because there's probably a reason for that occurring. So they might have some arthritis, they might have some old muscle tears that, you know, once they get moving, they're not causing as much restriction. They might have you know, just some stiffness, some fascial kind of stiffness from other previous trauma, or they may have some kind of dysfunction through their spine or something like that. So I do think that the warm-up's really important, but it's an important observation that you've made there, that your horse feels better after a warm-up. And so I would ask the question, well, like why could that be for my horse? So then you can understand it a little bit better and perhaps add in other things to your routine that improve that over time.
Oh, okay. Well, that's really interesting. Now I've got one more question that's just come in. We'll answer it quickly. Do you think that therapeutic ultrasound has its place in rehab? Is it effective?
Okay, so that's a modality, like there's so many modalities, but that's one modality I haven't personally used. So I can't comment on it from a personal perspective. They do, you know, it does have its place, and I think it's more with your soft tissue type of injuries. And I think it needs to be utilised by a professional who understands how it works. But yes, I do think that most modalities have a place. It's not about the modality, it's about the professional that's using the modality and their understanding of the modality to make sure that it's being used appropriately.
So the application over the actual method that they're using.
Yes.
And Raquel, when you say soft tissue, we're talking about muscles or tendons or ligaments? Or just muscles?
No, I think it's been used a little bit in tendons and even some bone stuff. Like I said, it's not a modality I've used. And it's not accessible to me around here either. But yeah, I think soft tissues, your muscles, tendons, not so much tendons. There's a lot of other options for tendons, but yeah.
Okay, all right, cool. Now, Raquel, if people want more information from you, how can they find out more and how do they get in touch with you?
Yep, so they can contact me through Integrated Veterinary Therapeutics on Facebook, and through Messenger is probably the easiest way. And then my email should be available through Equitana.
Yep, great. All right, we'll make sure that's up for you.
Email is probably the best option on Messenger, Facebook Messenger. Yeah.
That's great, Raquel. Thank you so much for your presentation today. It was amazing. We learned so much, and we hope you have a really nice day.
Thanks a lot, Claudia.